Good afternoon, or actually technically morning still in some places, most places. We are Indiana Conference, and we welcome all of you from around Indiana and hopefully around the world as we talk about some new things that are coming forth as we prepare for the 2017 annual conference. We have a great new opportunity as a conference and churches and individuals to support a global offering for basically miracle offering for global health that focuses on the Global AIDS Fund and also the Imagine No Malaria initiative throughout the United Methodist Church. Both worthy causes, and we're here with Bishop Trimble to learn more about them and why this is a great opportunity for us as a conference. So I welcome Bishop Trimble to this opportunity to chat with you and learn more about this cause or causes. And can you tell us a little bit about what it means for us to do something of a miracle offering? What is a miracle offering?
Well, a miracle offering is an offering that can only happen if we believe in the miracles of God, and we believe that together we can do far more than we can do individually. I think it doesn't matter if you're in a congregation that worships less than 50 or worships over 800 on a weekend. Because we're a connectional church, what we do together has a greater impact, and in this case, saving lives is what's going to happen as a result of the miracle offering from Indiana.
Mm-hmm. So as you think about that aspect of a miracle offering, and for these two campaigns, you had mentioned at one point in your initial video that $10 makes a difference.
$10 saves a life, and that's still the case. If we remember a few years back, some of us remember with the initiation of Nothing But Nets, we knew that a mosquito net with $10, a treated mosquito net, as well as the training of rural health workers, is literally saving lives, particularly in Africa where most of the deaths to malaria take place. $10 saves a life. It will save a life too with the kind of educational material and the kind of work we would do around treatment and education on HIV and AIDS. So these two global health pandemic health issues can be impacted if every single person in the Indiana Conference is willing to give at minimum a $10 offer.
Mm-hmm. And so an interesting point is for malaria in the United States was pretty much eliminated in the 1950s or by the 1950s. So it has a very significant impact in other parts of the world, and the commitment that the United Methodist Church has made, which is significant globally, we are hoping to raise some, I think,
$75 million.
Yes, sir. Yes, sir. And there are lots of conferences and churches and organizations around our denomination that have been working in many ways to support that. Correct?
Correct, absolutely.
Yes.
And Indiana's been part of many global initiatives before. We've been strong supporters of African University. We've been supporters of other mission outreach, but we've not had a formal opportunity to really be a big contributor to the Imagine No Malaria campaign. So this is going to give us an opportunity to kind of help lead the church in a combined way as we address global health, addressing both reducing deaths to malaria, and also reducing the stigma around HIV and AIDS, and hoping to bring the reduction of deaths to HIV/AIDS around the world as well.
And so an interesting point about that also is that at the 2004 General Conference, the body that spoke for louder, a little louder, I was being told by the studio support here, so is that we as United Methodist in 2004 committed to the work of the United Methodist Global AIDS Fund Task Force, which is an interagency body led by, actually, who's leading that as a chairperson right now?
They've invited the Bishop of the Indiana Conference, and I accepted the responsibility to chair the United Methodist Global AIDS Fund. And I said, being in Indiana, we have a strong commitment to health, to global health, to regional health, to health here in the state of Indiana. So I accepted enthusiastically, because this is something I have passion about anyway, Skylar, global health and the United Methodist contribution to addressing global health issues, particularly in Africa.
Awesome, very good. So as we've gone through this awareness phase of the miracle offering, we all kind of rallied behind the hashtag of why this matters. And you'll be hearing stories of why this matters as to many people who are involved in helping to spread the word about this great offering. So, Bishop Trimble, tell us a little bit about why this matters for you.
Well, it matters for me because I believe in saving the lives of children and mothers and impacting communities that we've been in ministry with as United Methodist. It matters to me and my wife, First Lady Rayselda Granberry Trimble. She's been an advocate for mothers and families and children for many, many years. And we were already engaged in the Nothing But Nets campaign in Maginot Malaria prior to coming to Indiana. And also I have a nephew who died of AIDS, and I think part of the reason that he died prematurely, I believe, was because of dealing with the stigma that's often associated with persons who find themselves into places where we can make a difference.
Very good, sir. Very good. So I want to tell our audience that to prepare you, generate your ideas and questions that you have about this great offering. Bishop Trimble and I will have a few more questions here together, but we'll also be looking out to you to hear it from you about your thoughts or glory sightings that you've had in learning about this, or just more information that you're seeking so that we can provide you with the best resources. So you also talked about a time that you were traveling to Sierra Leone and learning about malaria.
Well, that story has impacted me long before I knew I was coming to Indiana, actually before I was a bishop, particularly in rural communities where there weren't hospitals and there weren't clinics. The church was the only place where people could find help. So in 2006, I never will forget this, we were leaving, preparing to come back to the United States, and we had left one of the rural health clinics. And we were in our van. It was an 80-plus degree day. It was hot and humid. And the children were just playing all around us and around the van. And there were a group of children, ages probably from 3 years up to 12, gathered around our van. There was a little boy who had a knit cap on. It looked just like this almost. But he had watery eyes, and he wasn't jumping up and down and laughing like the rest of the kids. We later found out his name was Friday, and the other kids, it really let us know that this little boy, probably 5 or 6 years old, had malaria. And I have to be honest, Skylar, I don't know if he lived. I do know that in the clinics, some of the clinics we visited, they didn't have much medication at all. They didn't have the resources that we take for granted here in Indiana. They didn't have the kind of resources that they currently have now as a result of the Nothing But Nets campaign, and more importantly, as a result of the Maginot Malaria campaign. Now in Sierra Leone and in places where malaria has taken many lives of children and mothers and impacted many communities, we're making a difference. We've cut the number of deaths in half to malaria, and I believe we're going to have a similar impact as it relates to HIV and AIDS because of the work of United Methodist. So my hope is that the next time I go to Africa, I won't have to see little children that have on knit caps because they're cold and shivering and because they're impacted by malaria. That children will have nets, that will have treatment, and we will be fully engaged in addressing these global health challenges in Africa. I really want to see full engagement of United Methodist in Indiana and many other places, because I think that we as a denomination, we as a faith community can literally save lives if everybody says, I want to do my part.
Very good. Thank you for sharing that. So as you talk about why this matters and in your professional and spiritual space with us as a conference, how are you also, you and the First Lady, committing to teaching and preaching and educating and also supporting this offering?
Well, we are going to make a $1,000 personal contribution to our miracle offering, because we look at it as this $10 saves a life. We want to save more than 10 lives, so we believe that our contribution of $1,000 is just a small down payment on the kind of commitment that we have for this ongoing. I've been contributing to the Imagine No Malaria campaign for the last 5 years prior to coming to Indiana, so I want to continue to do that, particularly now that we're going to address not just one global health health crisis, but also HIV and AIDS.
Awesome. Very good. Very good. Well, I appreciate that and that knowledge point. So, friends, also, you'll have more opportunities to learn more about ways that you can support this offering, as in $10 from each of us can save a life, but also what other resources are available to help educate you and the community and the churches that we serve in with more information and resources to spread the word about this message. So as we start to look forward, I'm looking at my phone here and looking to see if we have any questions that are generating and opportunities. So let's see them come through. Let's see what we got here. Okay. What resources can I use in my church to tell the story of Imagine No Malaria? Are there sample bed nets we can use? So actually, our Imagine No Malaria partners have a website, imaginenomalaria.org, and it's available with tons of resources that are to tell the story of Imagine No Malaria and the work that's being done. And really, it's a global partnership, right, sir?
Absolutely. Yeah, we've been involved with the United Nations Global AIDS Initiative, the Bill and Melinda Gates Foundation, the Lutheran Church. Others have been engaged in this work. And churches have been very creative about taking nets and fishing nets and all other kinds of ways of creating models. And you can go to camping stores and get a mosquito nets, and actually do displays in local churches. But as you stated, there's resources online that churches can connect, and they'll be hearing from us as well at the Indiana conference.
Yes, that's very true. Actually, there's also tons of video at the last year, 2016 General Conference. There was a celebration moment with a song that had been created about the work of Imagine No Malaria, able, and the ability that God has to, God is able to make a transformation. And it was sung with actually a performer and contestant from American Idol.
Okay.
So that's been was a big moment, and there are tons of resources and videos from that. What else do we have out in the queue right now? Let's see. Gear us up. And I see one coming in. It's a lengthy one. We're still typing. Okay. And it's gone. What ways can my church be involved in the work of the Indiana Miracle Offering?
Wow, I'm glad you asked that question. I think every church, it doesn't matter what size you are, where you're located in the state of Indiana, you can be involved. We're hoping that every congregation will have an opportunity before annual conference to take up an offering on 1 or 2 Sundays, and you'll be getting material that'll be rolled out on our website, and every church will actually have physical material for taking up an offering. The education part is also critical, and those resources will be available so that maybe you can ask for mission moments, or if you have a mission committee, or get the youth involved, the confirmation class involved as well. I think one of my big goals is that if we can get every church to help with the educational process around how we can impact the global health, this global health crisis, and do it in a relatively short period of time between now and the annual conference. We're hoping every church will send an offering to annual conference, and they have an opportunity, maybe even before annual conference, to take up an offering and make sure that we have that offering at the Indiana Annual Conference.
So yes, that's a great thing. We also have a lot of different other resources that the bishop did talk about. You'll also be receiving packets with letter and bulletin inserts, offering supplies to do that. You also have some other touch points. Actually, World Malaria Day is April 25th, and there will be some resources and ideas that you can use in your communities or your churches to talk about that, but in around the issue of malaria, but hopefully also just the greater issue of global health and these 2 initiatives and their importance and their equality in that. So what are is there more going on than just treated nets? I've heard there's research on genetically modifying mosquitoes. So yes, there is a ton more that goes on in the Imagine No Malaria campaign, and also in the work of the global partnership around stopping malaria. So there's lots of other things that are happening, but one of the other main things is education about how to protect yourself, how to get treated early, and have that identified. And also the access to medicine is very important for those who are infected, correct, sir?
Absolutely. And I think at annual conference we're going to have one of our teaching sessions around global health, and they'll be addressing some of those things as well. Mm-hmm. So much of this information is available online. I'm not an expert in the science of it, but I certainly have been around persons that are very much committed to both the science and the delivery of health, which is one of the strengths that we have as a denomination, is because we're on the ground in places in Africa with rural health clinics, with local congregations, and congregations that often have small clinics as well. So training community health workers is a big part of addressing both of these issues of malaria and HIV and AIDS.
Very much so, very much so. So our next question is, what sort of non-electronic, non-video resources are you going to make available to those congregations that have no video screens and aren't linked into social media? Well, great question. Each church in Indiana will receive a letter from the bishop that includes a bulletin, actually 2 bulletin insert types, and also offering envelopes, as well as a poster to use to help spread awareness of this offering. And then what we're also providing is there is also a group of clergy from around Indiana working on sermon starter ideas to help conversations have fruitful space to discuss and learn more about the impact of global health and really the importance of what it means for us to be a healthy world where everyone has access to good health opportunities. So those are things that are coming. Let's see here. Let's see. Why does the website say send money to Illinois? Where should we send money? That is a great question. We have a drop box in a place called Carroll Stream, Illinois, where many of us have sent our credit card payments for 1,000 years. So you might have a begrudging relationship with Carroll Stream, Illinois some days. But that is where all of our donations go. They get counted and allocated to the right fund immediately as they arrive. So for those of you who are doing offerings ahead of time and want to send in money ahead of time, you are welcome to do that. We definitely encourage you to bring money to annual conference, but that is up to you. If you send it to Carroll Stream, Illinois, it gets allocated immediately. Our conference finance team gets a notification. It goes into the appropriate fund, and we will have a total of that money to share at the end of our offering time, and things are counted at annual conference. So the next part is, are we to bring our offering to annual conference? Yes, you can. Yes, you may. You can bring in big checks if you want to, if you've done something that you want to celebrate, and say if you've got a tremendous offering from your church and you want to hand the bishop a large check, please do so. If you also want to throw in dollars, cents, coins, and everything else, our checks from your congregations, you are welcome to do that. There will be an offering opportunity Friday afternoon during the business session to do that work, and we'll also celebrate the work that God is doing to transform lives around this issue at that time.
And we don't have to wait until annual conference, because we want to know that we've already made a commitment to save lives. If it's 50,000 lives or 100,000 lives, if we have commitments before annual conference and offerings been taken up before then, and the annual conference receives it before, if you send it by way of your lay member to annual conference, or the clergy member, or you get it to your districts, and as Skylar has said, we're going to take up a big miracle offering at annual conference. And we already know that some people are already making a commitment even before then, before we arrive at annual conference.
And the next question is, do we know what AIDS treatment costs around the globe? What does it cost to save a child from death by AIDS? So that would be something that would definitely be a more fuzzy number to come up with a full metric on. I think there is research available for it in different places, but I think you'd find a variety of numbers that would come up. The appropriate question, appropriate answers to say is that it is expensive in some ways to do cost of treatment for those who are living with AIDS long term in any place in the world. As you think at the cost for a person living with HIV/AIDS in America, and the access and availability of medicines and funds and insurance costs and what insurance covers, but to imagine that on the scale of a person's income ratio in Africa to the cost of medicines, while it probably costs less than it does in America in some places, still you have people who make sometimes $1 and $2 a day trying to afford medicine that might cost them over $300 a month for just one medicine prescription. So what the Global AIDS Fund does is to continue to work in partnership around the world with many different partners to provide education to, one, prevent the spread of HIV and AIDS to as mothers who are carrying children, to help them know what's appropriate and get tested so that they can then have the treatment to prevent their child being born with HIV, and then also to help children who are born with HIV understand the appropriate treatment protocols that are available to them and understand the importance of taking treatment medicines to prevent AIDS, and also to prevent the spread of AIDS to or HIV and AIDS to other people.
And I think that there's two things. One, I would say the mother-to-child transmission has been a big focus of the United Methodist Global AIDS Fund and some of the grants that have been given to countries and places. The other thing is access to medication without cost to those who need it most. So those are the reasons why the work we do here in Indiana is so important, so that persons who couldn't afford this, even if the cost is being brought down, they still couldn't afford it if you don't have much of an income. So that's why it requires those of us who have much, those who receive much is expected of us. And so I look forward to a tremendous outpouring of commitment and compassion in this matter.
Yeah, and also an interesting touch point. Some people might look at the miracle offering and say, well, why Imagine End Malaria and Global AIDS? But one of the interesting parts of that is that so many people who go in with symptoms of malaria also discover at the time that they also are HIV positive. And that's for the first time that they've offered. Or they may have thought or are known or suspected, but because there is so much stigma and still so many places in the world that they are hindered by what they would think the perception of others and the community would treat them before they would go get tested. So encouraging education is a strong component of both of these initiatives, and their work does overlap. So it makes sense that they are, partnered together in this global offering that is Indiana's miracle offering for global health. So I thank you for the time, and I also want to give the bishop just one more chance to say goodbye and his closing words to the conference as well.
I'm looking forward to a great annual conference, and I believe the miracle offering is going to be a testimony to how good God is and how good God can be when we work together and recognize that we have far more than we need, and together we are far more than we can be individually. In 2018, we'll be hosting the National HIV AIDS Conference right here in Indianapolis, so in the state of Indiana. And so much of what we are doing not only impacts global health around the world and in Africa, but it will be impacting persons right here in the state of Indiana.
Awesome. Thank you so much, Bishop. So as we said, there'll be more resources available on our website, inumc.org/globalhealth. You can also find information on Imagine End Malaria on their website or the Global AIDS Fund on umcmission.org. And also, if you have any questions, feel free to reach out to us as a communications team, and we'd be happy to provide any answers or additional resources. And also join us next week as we chat with members of our extended cabinet, Reverend Michelle Cobb, who is the conference superintendent for the North Central District, and also Ian Hall, who serves as our Director of Administrative Services and Financial Services and Conference Treasurer, about why this matters. So thanks again, and see you next week.